Thank you for the opportunity to testify today about the health insurance market in Alaska and the need for congressional action to help people in the individual insurance market in 2018 and beyond. Alaska has amongst the highest cost of health care in the nation due to low population density and limited health care provider or facility competition in much of the state. While the individual mandate reduced the number of uninsured Alaskans, an unintended consequence was that the high cost of the individual health insurance premiums increased even further. Premiums in the individual market in Alaska have increased by 203% since 2013. On average, an Alaskan in 2013 was paying a monthly premium of $344 per month, and in 2017 that premium is $1,041 per month. To stabilize this volatile market, the Division of Insurance worked with Governor Bill Walker to create the Alaska Reinsurance Program. The 29th Alaska State Legislature passed the governor's bill in 2016 with overwhelming bipartisan support. The Alaska Reinsurance Program is intended to provide stability to the individual health insurance market, mitigating rate increases by removing high-cost claims. As planned, this had an immediate impact on rates. Prior to enacting the reinsurance program, indications were that the rate filing from the single insurer in Alaska would be close to 40% in 2017. After enactment, the rate increase was a moderate 7.3%. An independent actuarial analysis estimates the reinsurance program will increase enrollment in the individual market by 1,650 individuals. Modeling also indicates that the program may attract healthier members to the individual market, further reducing premiums. After enacting the reinsurance program, Alaska then applied and was subsequently approved for a federal ACA Section 1332 state innovation waiver. Alaska waived the requirement of a single risk per pool and proposed that the federal government provide pass-through funding for a period of 5 years to secure the state's reinsurance program. The pass-through funding is based on the savings generated as a reduction in the advanced premium tax credits. It is estimated that the Alaska Reinsurance Program will save the federal government $51.6 million in advanced premium tax credits in 2018 relative to what would have been the tax liability had the program not been put into place. After the federal pass-through funds are accounted for, the state will be responsible for providing approximately 15% of the $55 million program cost necessary to stabilize the individual market. As you consider congressional action to stabilize premiums across the country in 2018, we offer the following perspectives. We'd urge Congress to not disrupt the health insurance market, but instead focus immediately on stabilization. Any decision made after the filings are approved could cause unintended, unfavorable disruption to insurance markets. Uncertainty destabilizes the market. Committing to funding cost-sharing reduction payments through at least 2019 will keep premium rates from increasing at even higher rate. We support collaborative reforms developed in consultation with state regulators that strengthen markets with the goal of health insurance not only being accessible, but affordable. Programs that allow states to address the unique needs of their citizens, such as the Section 1332 waivers, are vital to the long-term stability of health insurance markets. Further deliberation on health insurance taxes are needed. In particular, citizens of states like Alaska that already face extremely high healthcare costs may be unfairly penalized by the Cadillac tax. Additionally, exempting insurers from health insurance tax in counties or states served by one insurer may be an effective way to increase choice or competition that will benefit citizens, but should be considered for all states as a moratorium. Please consider continuing and funding the Navigator and Assister programs. In rural areas of Alaska, insurance brokers and consultants are hard to find. These programs reduce the number of uninsured citizens and maximize market participation. Media and public announcements are vital to open enrollment being successful. A review of regulations may reveal that some that are unnecessarily burdensome and costly to both medical providers and insurers. We are also interested in coordinated efforts with healthcare providers to address the underlying costs underlying drivers of healthcare spending. Even under the extreme tight considerations you face to address 2018 premiums, please make your decision in a bipartisan manner after thorough analysis. We are here to assist you in any way we can, and I look forward to your questions. Thank you.